Okay, this is skill 2.34, applying a transdermal medication patch. So, we've checked our MAR, we've removed the appropriate medication from the system, the storage area that it's in, okay? We've checked the MAR with the medication label to verify that it's the correct medication. We've also looked at the expiration date. So we've checked the medication. You're going to check the medication label 3 times for safety. One, when you take it out of storage, look at the date of it, look at the name of it, look at the dose of it, make sure it's the correct medication, right? When you're preparing it. So how are we preparing a patch? Well, the patch is going to come in a container that looks just like this, okay? This isn't the actual patch itself. This is just the envelope, the covering of it, okay? The medicine is inside, so we need to prepare it. Some of them you can rip open, okay? Some you may need scissors, okay? So that might be one of the supplies that you might need for this skill, right? Okay, so you take the patch out of the container, and the patches can vary, okay? This one happens to be a circle. Some of them may be a square. Some of them, you know, could be a rectangle, all right? So what you want to do, and just like any medication, right, anything that we're putting on our patient, any dressing or anything, we need to put our what? Correct. Our date, our time, and our initials, okay? So how do you know which side to do? So you have to open it a little bit and find out which side is going to be the sticky side, okay? Whoops. What side is going to be the sticky side? So we know we don't want to write on this side, right? So we want to do all of our stuff on this side. So what we're going to do is we're going to put our initials, our date, and our time, okay? Okay. So I have that done, right? Oh, yes, you're right. Okay, I'm handling a medication that could possibly be absorbed through my skin. So we want to make sure that we have gloves on. Right, exactly. All right, so we've put our gloves on. We've prepared the correct amount of medication without contaminating it, right? So we've got the correct medication, right? We've prepared it. We've put our date, our time, and our initials on it, okay? We're going to alternate the area where each dose of medication is. Okay, so if you're going to put this on for the first time, you're going to choose an area of skin that is unbroken, doesn't have a rash, and that this patch won't rub off of, okay? So generally we try to keep it in the upper chest, upper arm, and sometimes the back area when we're putting on patches, okay? So when you do that, when you're the first person putting on the patch, you want to make sure that you put the location that you put that patch in the MAR, okay? So there'll be a location, a place in the MAR for you to put the location of where you put the patch, so that 8, 10, 12 hours afterwards, when it's time to replace this patch, the next nurse, because it may not be you, will know exactly where to look for that patch, okay? So let's say that there's one already on, and the patch is over here on the upper right arm, okay? What we would do is we would remove that patch, okay? Fold the patch into itself so it sticks together, and throw this old patch right into the sharps container or into the the proper receptacle at your facility. You're going to have to know how your facility wants you to get rid of the medications, okay? All right, so you fold it onto itself. Now, since the medication we just took off was on the upper right arm, we could go anywhere but that place, okay? So you can go upper chest wall right, upper chest wall left, upper arm left, okay? So we're going to go ahead and place it on, because it's closer for me, on the upper right chest wall, okay? And literally, you just place it on your patient, okay? And if you look, It's really hard to see right now, but if you look, all you're going to see really is your initials, your date, and your time, because that patch kind of, you know, blends right into the skin, doesn't it? Yeah. So that's how you put on a transdermal medication patch. Now, you would have cleaned the skin if you needed to, right? Okay. So you may have needed an alcohol pad to clean that. When you put this on, you want to push on it for like 30 seconds to make sure that it's sealed, it's on the skin really good, okay? You're gonna remove your gloves at this point, make them comfortable, get them all put back together again, okay? Remove your gloves, I already said that. Wash your hands and document, okay? Document what medication you put on, what time, what date. The location is a big thing, okay? All right, so that is scale 2.34, applying a transdermal medication patch.